Hi everyone, welcome. Welcome to Wednesday night. It's My Baby Experts and we are back with another amazing show for all of you. Let me make sure that I am in the right mode here. It's one I did not check. And we are. If we weren't, we are now. Hi everyone. I'm going to wait for everybody to jump in. I am Shari Criso, and for those of you guys who are new to our show, we've been doing this for a long time, but we have new people every single week. So exciting. And I am here to help you learn. My phone's ringing in the background, so everything's distracting me right now. I just want to say who I am for a moment. My name is Shari Criso, and I am a registered nurse. I'm a certified nurse midwife. I'm an international board certified lactation consultant, and I am the host of the show. And I am going to say hello. Hi, Deneen. Everyone's jumping in now. We have a great topic for you guys. How have you been? It's been only a couple days since we were here. We did a beautiful Q&A on Saturday night, which was great. And tonight we've been waiting for the show. I've been waiting for my special guest who you see sitting here for a couple weeks. I know that we've been eagerly trying to do this show, and thank you everyone for being so patient waiting for it. We have a fantastic topic tonight on home birth. And, you know, we've been doing this for so long, and it occurred to me that this was a topic we had never covered, but there's so many questions that come up and so many moms that are considering this option and choice for themselves that this was a great time to have this conversation and really bring in some experts to talk about it. So without further ado, I just want to introduce our guests here tonight. This is Jessica Moore, Nancy Myrick, and Ami Burnham, and they are all part of a film that Jessica created called Why Not Home. And I saw the film on Instagram. I had found it on Instagram, found Jessica, and I was like, this is so great. And I had a chance to watch it, and I loved it. And Nancy and Ami are both midwives who appeared in the film, and so fantastic. Thank you guys so much for being with me tonight.
Thanks for having us.
Thanks for having us.
Yeah. Fantastic. And everyone's jumping in. Hi, ladies. Hi, everyone. Yes, they're all coming into the stream now. I'm going to let you guys have a moment to introduce yourselves and give your backgrounds because, you know, everybody wants to know, like, what you're doing, who you are, and you're the best ones to talk about it. So, Jessica, for a moment, just tell us a little bit about yourself.
Sure. So I'm a family nurse practitioner. I trained as a registered nurse, worked in pediatric ICU, and went back to school to be a family nurse practitioner. I work in a federally qualified health center, and I really got interested in birth and specifically home birth when I was pregnant and had both of my children at home. Had fantastic experiences and was really inspired to tell a story. And so I made a documentary. I'm not trained as a filmmaker, but with a lot of support and time and love, I made the film. So.
And such a great film. Go ahead, Nancy.
Yeah, my name's Nancy Myrick, and I'm a certified nurse midwife. I graduated about 15 years ago now from the UCSF nurse midwifery program and went straight out into doing home birth as a nurse midwife. I did it for about 13, 14 years, and then most recently with two other women, opened San Francisco Birth Center. So I'm now mostly doing birth center birth right here.
Yeah. And that's where you are right now, in your birth center.
We are. This is one of the birthing rooms back here.
Yeah. So great. Awesome.
All right, so I am Ami Burnham. I'm a licensed midwife and a registered nurse and a board certified lactation consultant. I have been a midwife for about 16 years. I worked doing home birth in Chicago for a couple years, and then here in the Bay Area for another 10 or 11. Nancy and I were business partners for a long time and had a home birth practice together. I had a son 3 years ago, a planned home birth that ended up in the hospital and ended up in the movie as well as partly as a result of that transfer. And then I just had a baby 5 months ago, a successful home birth. So since they were born, I'm not doing a ton of midwifery work, a little bit of assisting here and there, but mostly focusing on lactation and leading mommy and me groups and teaching stuff that's a little more friendly schedule for young ones.
Well, I totally hear you, Ami. Just so that for those of you who don't know, that is really my background too. And so midwifery was what I did for 15 years, and I stopped when I had my second and became a lactation consultant and started teaching. And I totally get it. It's not an easy schedule for little ones, especially nursing babies.
Yeah, exactly.
Totally get it. Totally get it. And I miss it. Just seeing you guys there in the birthing center and the conversation we're going to have tonight makes me definitely miss my old life of doing this. But it's great to be able to spend time with moms online and bring this kind of information to them. So, yeah. People are already asking how they can watch the documentary, how they can watch the film. Joe's going to go ahead and he already did. Posting a link. Okay. You can just go to whynothome.com. The film is available on the website, also on iTunes and on Amazon, right?
Mm-hmm.
And right. You can get it anywhere from any of those places. I'm going to show the trailer in just a moment so that you guys can get a little glimpse, an idea of what the film is about, and a little idea about it. But I also want to talk about our sponsor for a moment. We have an amazing partner who I've worked with for many, many years. They have been in business since 2002 when I actually first opened my learning center and store here in New Jersey. And they were one of my first brands that I had on the shelf. It was Earth Mama Angel Baby, now called Earth Mama Organics. They had a change in their packaging and a change in their name, but it's still the same wonderful, amazing products for moms and babies. They have everything that you could think of needing for pregnancy, for birth, for baby care, all organic, all non-GMO. And tonight we're going to be giving away a fabulous bundle of all kinds of birthing and postpartum products from them. We have the periodic tea, which I'm actually drinking some right now. It's so good. It's cinnamon and it tastes yummy. And the herbal sitz bath, the herbal perineal spray, which used to be the Earth Mama bottom spray, which I used when I had my children. This is how long I've been working with them. When I had my first daughter 16 years ago, I did use the spray and the perineal balm, and also the skin and scar balm, which is great for stretch marks and also for scars. We'll talk a little bit more about the products later, but they're fantastic. If you've not seen Earth Mama Organics, definitely go check them out. Joe will give them a link. Yes, you love their stuff. Me too. Let's get some hearts going across the screen right now. If you've used Earth Mama or if you'd like to, let's get some hearts going. And also to enter to win the products tonight, just like or love this post. You know, I like loves. Love this post. Comment here. Tell me why you need it in your life. Tell me how it will make a difference, how much you love it. And then we will choose a winner later, okay? Let's show the video, okay? Let's do that first. I want to show the trailer. Hold on one second while I cue it up for us. There we go.
I think it's been so long since most babies in the U.S. were delivered at home that it's sort of been forgotten.
4, 5. Honestly, I thought people who birthed at home were crazy up until I got pregnant.
It was interesting because I had some people going, "What are you thinking? You know, you see what happens here every day."
It was drilled into my head during training that that was not appropriate for anybody.
There's just a lot of fear surrounding childbirth.
Good morning, Joe. Where do we begin today? 99 chances out of 100 in a hospital.
Lots of issues come up because a person's in the hospital and because we meddle so much.
Once you induce labor, you have interfered in a very strong way with the normal physiology.
Are we really surprised that there are so many surgical births in the United States?
We rate near the bottom of large industrialized countries in terms of maternal mortality. If every birth you attend has a lot of technology attached with it, you start to think this is really the only way babies can be born.
There's something in our system that's not right, and that's what we need to wrestle with.
We live in a profit-driven society, and profits do not equate with safe birth.
And what is high-quality maternity care? That's what we have to define now.
So don't hesitate to call me, even before it feels really intense.
What does birth look like? Why have we made these assumptions that it has to happen in this one way?
It's that social support that I think midwives automatically do, where you stop long enough to really relate and connect to the patient. That seems to be the difference.
Home birth is happening in the United States, and so how can we address our shared responsibility and make it the best it can be?
He's a big boy. Our women and our babies thrive, and we know that it's because of the way we deliver the care.
It was just at home, and it was in my own space, and I felt like I had some control over it.
Oh, good job. Very good job.
It doesn't matter in the end where you have your baby, but being able to do it at home, it can be an amazing experience, life-changing.
Awesome. Let's see what come back here. Fantastic. Thank you so much. It's so great. What a great trailer that was, giving just a little glimpse. And for anybody who's interested in watching, I highly recommend. Joe and I watched it together, and I thought it was just fantastic. And Jessica, talk to us a little bit about what inspired you to make the film, and then you have a particular angle that you came to the film that I thought was really great and interesting.
Sure. So when I was pregnant and then after I had my children at home, I was surprised at the reactions that I would get from, friends, family members, colleagues, when they would ask, where are you delivering? And I would say, I'm planning a home birth. It would run the gamut from like, oh, wow, like I could never do that, or to, you're crazy, or my baby would have died if I had my baby at home. You hear that a lot, and it just really didn't match kind of how I felt about the decision, or the other kinds of colleagues I knew who were making similar choices. So it's definitely not something that I would have done if I felt like there was an increased risk. But it was really something that I had, looked at the data and thought about, what are my own values and needs, and where am I going to be best supported for a safe delivery and a positive experience for me and my family. And I felt like the media narrative, especially around home birth and families who choose home birth, is primarily, that home birth families are, really crunchy hippies, and they don't like medicine and they don't like doctors. And so I felt like this angle on the story of talking about family doctors and OBGYNs and labor and delivery nurses and certified nurse midwives who are all delivering babies in hospitals. So they know what that experience is like, and they understand intimately about the risk that is involved in birth, and they are choosing to have their own children at home.
Yeah.
So I felt like that had the potential to reach a different audience, and to engage care providers, labor and delivery nurses, OBGYNs who might have some judgments themselves about home birth practitioners and also home birth families. So it was kind of both of those things were kind of what drove me. And then my hope is that that this story will help to improve access for all families, because right now, unfortunately, because of cost and insurance coverage and just access to the information, primarily, home birth families are more well educated, have more financial resources. And it really felt like that was unfair. And I really would like to influence policy so that it is more accessible to all families, because, you know, low risk women of all kinds can benefit from this. And it could be really, you know, it has the potential to reduce costs to the system also. So
absolutely, such a good point, such a good point. And you know, I particularly related to the film because I was a certified nurse midwife doing hospital births, and because of being in the hospital all the time, it was a choice that I made to want to have a home birth as well with my first baby, and labored at home for about 15 hours until we needed to go. And you know, it was still a wonderful, amazing birth, and you can have that birth depending on who's with you, you know, and being able to deliver at home or at the hospital, either are great. And I'm happy for the way my birth went. But it was sort of that, like what we were talking about when we first spoke about wanting to do something different than what I was doing, which is sort of what you're highlighting here in the film. Like, why was I choosing something different than what I was providing? Kind of knowing a little bit more about what happens in a hospital.
And it was also really important to tell a story without judgment, because, you know, there are good reasons to deliver at a hospital, and a lot of families are more comfortable in a hospital setting. You know, it's not, my point was not that everyone should deliver at home, or if you choose to go to the hospital, you know, you're not as strong or as, you know, brave, or but that just, it should be an option, and there's no need to, you know, add more judgment regardless of your choice.
Absolutely. Absolutely. Yeah, as a birth choice, it's becoming more popular again. And this was the way we always did birth up until a certain point. And now it feels like that it had gone all so much towards the hospital. It feels like it's kind of coming back, home birth. And what you highlighted with practitioners choosing it, is this what you're seeing and what you're in your practices and what you saw statistically? Go ahead. Whoever wants, just jump in. Anybody jump in.
Well, I think the numbers are still, you know, nationwide, still pretty close, around 1%. You'll see certain areas of the country, there's certain pockets where you could have 2, maybe even 3% out of hospital birth rates, but it's still generally kind of hovering in that 1% range. So, you know, obviously we're very biased. Everyone that we, most people we come in contact with are choosing to have their babies out of the hospital. But yeah, it's certainly still considered a pretty fringe choice, I think, for most people, but there is more media presence about it. And I think that's really exciting, and using out of hospital birth as a platform to talk about respectful birth and honoring women's choices and what it means to have great and respectful women-centered and women-focused care providers wherever you choose to give birth. And I think that's the really important discussion that comes out of this film and other films like it, even more than, like Jessica said, then, you know, we're not trying to get everybody to deliver at home. That's not the, you know. So I think overall the numbers are the same, but I do think that, like this ProPublica stories that have been coming out about the unfortunate maternal mortality rates in America, I think people are starting to realize that we don't necessarily give great maternity care in the U.S., and something needs to shift and something needs to change. And maybe this is one direction where change can come.
Absolutely.
I would just add that there is a big expansion in freestanding birth center birth, which has actually a lot more in common with home birth than it does hospital birth. And that's, I think, some kind of a middle ground that people are more comfortable with a lot of times than actually giving birth at home. It's very similar in its model. It's midwife-centered, midwife-driven care, family-centered care, you know, no big machines.
Yeah, such a good point. And you're actually in your birth center right there. And it does look like you're at home, and it does feel like a home. You can feel it just looking at you two sitting there. But I guess for many, and I guess it depends. We'll get into the conversation about where would you need to be located to have a home birth, and what would you need to have at home. So that could be part of the reason why somebody could choose a birthing center as well.
Yeah. I mean, I do think it gives options for people who are for whatever reason, just not comfortable in their own home. Maybe it's roommates, maybe it's neighbors, maybe it's the mess, whatever it is. It does offer sort of a home away from home.
Yep.
You know, it has a couple downsides. You still have to get in the car and get here, and that can be a real bummer. I'm really a huge fan of home birth for lots of reasons.
Yeah.
It's, you know, laying eggs in your own nest. So it's a lovely variation as well.
I saw somebody mentioned in the chat that their midwife is an hour away or the hospital's an hour away. I can't remember exactly, but that's another reason to choose a birth center birth. You know, if you're a long way away from a hospital and you want a home-like experience, a birth center that's located close to a hospital is a really good choice. I've heard of a midwife who's a home birth midwife, and for clients who live far away from the hospital, there's a hotel near the hospital that she has an agreement with, and she'll deliver babies in the hotel.
Awesome. Yeah, that's great. Hope they have big tubs in the
the big jacuzzi ones. Nancy, I really like what you said about how the birthing center is more like closer to a home birth than it is to a hospital. And so for that to have that other choice, other than a hospital and other than home, it really is great. Mm-hmm. Let's talk a little bit about why do women choose home birth in the first place? Because there's different reasons why women choose at home, and just love to talk a little bit about that.
So I can tell you why I chose home birth. For me, it was really about being comfortable with the people who were going to be with me, knowing who was going to be there, feeling like I could really trust them, like I knew them and they knew me, and that I could be really comfortable and private and in my own space. And, I knew that nobody was going to be pressuring me, to do something that I wasn't comfortable with. And that was really important to me, and that it would be kind of allowed to go at its own pace. And, I knew that if things changed and I needed to go to the hospital, that was fine. I didn't have any problem with the hospital. It wasn't that I was, going against a hospital birth. It was a really positive choice for me that, I felt like this was the best choice for me and my family. And I was amazed after my first birth at what an awesome experience it was. It surprised me because, I hadn't ever been to a home birth before. I knew a few friends who had had home births, but I had only seen hospital births. And still, a lot of the media narrative around birth is that it's, terrible and painful and you're screaming, and it was an intense experience for sure, but it was so rewarding. And then just being in my bed with my baby and my husband, just pretty fantastic.
It is fantastic. Yeah. Is there anything that you guys can?
I was going to say, I think that's an experience that we have when our clients, our folks that have home births or birth center births, when they talk about their births, they use words like, that was powerful, or that was intense, or that was amazing, or that I felt so strong. Where often when you hear people talk about their hospital births, it's like, oh, that was awful. It was torture. It was, luckily the doctor came in and saved me. Or it's really a different language, a different perception of feeling. It doesn't mean when you have a home birth that it's easier. It's just context and feeling, having that power of running the race and finishing it. It's surrounded by support and love.
Yeah.
And sometimes it's really simple. Where I worked in Chicago before I moved here, our clients were primarily recent immigrants from cultures where home birth was much more common. They also, many of them were undocumented, so they had some anxiety around being in a hospital environment. And they also didn't have childcare, and lots of kids. So it was often like it was much more convenient for us to go to them. And there wasn't a big fuss about it. It was just sort of like, well, I'm just having my baby, and I've got my other couple kids, and my partner works 2 jobs, and we're just going to have the baby here so we don't have to go anywhere.
Yeah.
So I think there are big intellectual, if you look at the research, and if you're safe and healthy, and it's an uncomplicated pregnancy, that you may even be safer at home than in a hospital environment in certain circumstances. But there's also just the very practical for some people, that this is just makes more sense for their family and what they're doing.
Yeah,
I
absolutely.
think the other big driver for me was I knew that I wanted to have an unmedicated natural birth, and I felt like I would be supported and be more likely to have that outcome at home, where there just wasn't anything else available. And I vividly remember in my first birth, there was a moment like fairly early on. So my water broke and my contractions like pretty immediately were like strong and consistent. And I was like in my bathroom in the toilet, and and like, I think if I had been in the hospital and somebody had been like constantly asking me about like, are you in pain? What's your pain like? Do you want something? You know, like I might have just like thrown that plan out the window, you know, and said like, oh no, actually this really hurts. You know?
Yeah.
But because I was in this environment where, you know, I could, you know, try different things, move around, and nobody was asking me about it all the time. And there were just like other options, and, you know, an epidural was not an option. So.
Right.
Yeah.
Right.
I told them all I was ready for my epidural at about 9 centimeters with the second one.
Everyone's ready at 9 centimeters.
Okay, guys, here we go. If we were in the hospital right now, that would probably be happening.
And then the baby came out.
And then the baby came out.
Yeah, and then it's just gone. Yeah.
It's interesting because when I think about when I was pregnant with my first and I was doing hospital births, you know, you would think that being around births all the time, you would have these images in your mind of all the things that could go wrong that would scare you into thinking I have to be here in the hospital. But it was really the exact opposite for me. I think because of the way I practiced in the hospital, which was very much like a birth center, the way I practiced, where the door closed and no one came in and we just did our thing. And I saw, because of so little intervention, even in the hospital, just based on the patients that were coming to me and what we chose to do, I saw so few complications. Birth was really, for me, in my mind, as a midwife with no children, was really a normal process. Like I didn't feel that fear around it, even though I was around it every day. So it felt like the right thing to do. Like, well, I could just do this at home. I have, you know, my friends, my doulas, my nurses, everybody who I work with, and my midwife and my husband, and I'll just do this here. And like I said, it didn't work out that way in the end, but doesn't matter. It was still, I think, going into birth without that fear is really, really important. And being at home, you know, for so many women, one of the biggest issues they have is the fear of birth, of what they've heard or the stories they've been told. And walking into a hospital just can be a scary thing, and it really does impact your birth and your labor. So being at home and in the comfort, I would assume, for me, that's how I felt. I felt so comfortable the whole time.
Be able to be in your own kitchen and eat your own food and in your own bathroom, sitting on your own toilet, your own tub. Think about all that other stuff. Yeah.
I think ultimately in birth, we are mammals. And when you think about what mammals do, they go into the den, they go, you know, the dog goes under the porch, or the cat into the sock drawer, into these safe places. When you venture out into some other area, like a hospital with all these strangers you don't know, it suddenly feels like there's, you know, a lion in the room, and that's scary, and things shut down. Mm-hmm. Being at home, you're just there with your other herd, right?
Yeah, your people.
Yeah, and I guess another reason that people choose to, or it may be just the benefit that you realize after, is that you really don't go anywhere after it's over. It's not the process of being discharged and all the paperwork and all the other things. You're right there in your own bed. You're nursing, you're eating, and carrying on.
And just those car rides, the labor car ride and the postpartum with a newborn car ride. Especially if your bottom is sore. Woo, terrible. We had so many second timers who had their first in the hospital and would come to us for the second and say, we say, you know, why do you want your baby at home? They say, you know what, honestly, I don't ever want to get in a car in labor again. And I want to be in my own bed with my baby's postpartum. They were like, the birth, I kind of could care less where the baby actually comes out, but it's those two things that I really.
I vividly remember that car ride.
Yeah.
I was laughing in the other room because he remembers it too.
It's hard to forget.
I hear him laughing. He's like, oh yeah, the car ride. What about if they're like, as far as like if there is an emergency, you know? So this is the biggest concern that people who think about having a home birth or they're afraid of it. What if there is a problem? I mean, what do you have in place, and what do you bring with you? What do we need to do and be prepared for?
So we are trained to handle emergencies. First of all, true obstetric emergencies are actually quite rare. If you have fulfill the criteria that we require people fulfill to plan a home birth. So it has to be one baby, head down, healthy normal pregnancy, and at term, so that she's 37 weeks to 42 weeks, and everything else is looking good. No high blood pressure, no, diabetes, things like that. And assuming all of those things come into play, true obstetric emergencies are pretty rare, and we're prepared for them. So we carry 4 of the 5 anti-bleeding medications that they have at the hospital if mom were to start bleeding postpartum. We carry IV fluids. We carry suture, which isn't an emergency, but we can suture women and use lidocaine to stitch them up. We carry little bag and mask and oxygen and supplies to resuscitate a newborn if the baby comes out and is having a hard time.
We carry IV fluids. If mom loses blood or is just dehydrated, we can give IVs. We, I say we try to be good Girl Scouts and be prepared for what is coming. And when we arrive, we take our giant backpacks off our back and lay everything out. And almost always at the end of the day, we just pack it back up again. Yeah. But we have it all there and ready. And we're very lucky in where we live here in San Francisco that we also have some great hospitals and great relationships with those hospitals. That if we need to transfer, we can get to a hospital really quickly and get great care there as well. Yeah.
And again, I'm not a midwife, but from talking to a lot of midwives and doing this project and looking at the research, if you are under the care of a midwife who is, being vigilant and monitoring you as they do at home, then there aren't a lot of things that come up out of the blue, like there are usually you notice things, warning signs along the way where a midwife might say, I think something is not quite right here. Let's go ahead and go into the hospital. And, I think that that's something really important to talk about with your midwife. If you're thinking about a home birth, is like, tell me about your last couple transfers. How did those go? What are some things that, might make you concerned? And, you don't want to choose a home birth. People talk a lot about home birth. What's your transfer rate, and what's the goal for that? Well, you don't want somebody that never transfers because there are reasons to transfer. But, probably if somebody's transferring more than like 30% of the time, then they're like probably either taking people who are too high risk, or, transferring for things that, you probably could stay at home for.
Yeah. So. Well, I love what you're describing because I completely agree. Like I said, I had a hospital practice, but the hospital that I practiced in was not a teaching hospital. There really weren't any doctors in the house, no OBs on call in the hospital. So I'd have to call someone in. So kind of like a birthing center, most of my babies came in the middle of the night. And I was also an RN there, a labor and delivery nurse there for a long time with no doctors in house. So that was just the way I practiced it. And what you're describing about, anticipating issues. This is what I feel midwives really are trained to do. We're not trained. We are not able to do a C-section and just rely on that. We need to anticipate when something's going to happen, to see the risks in someone, to see the warning signs that do come up. And there are, if you're paying attention and you're with your patient, there are warning signs that will tell you if something may not be perfectly okay. And I remember doing the same thing because I needed time if there was an emergency, if we needed to have an emergency C-section, I needed time to call my partner to come in and do it. So it's the same type of thing. And I think it really comes down to, like you said, speaking to your midwife, right? And interviewing and not wanting somebody who transfers too much, but somebody who will transfer you if it's needed. And not waiting till the very last second either.
And this is one of the things that the film highlights, I think, really well. which is one of the hard things about out-of-hospital birth in the United States, is that state to state, it's very different. And even community to community, you know, we have great hospitals in San Francisco. 4 of the 5 labor and delivery units are really happy to work with us and take our clients, and we don't get kicked out and there's no judgment. Even across a bridge from us, there isn't a place like that where midwives can easily go and work with their clients in a more collaborative agreement. And that's where sometimes we see some issues with safety. And there's lots of there are parts of the country where the kind of midwifery license that I have, I'm considered illegal. I could get arrested for attending births there. And in those environments, as you can imagine, a midwife trained like me is not going to go to a hospital as readily. And that's where safety can be put at risk, because people are really committed to having their home birth. But now things are a little weird. Can we stay? If we go, things are going to be really ugly. So, and I appreciate that Why Not Home does touch on this issue, which I think is really a crux of out-of-hospital birth in the U.S. and kind of the problems with the way that it's set up right now, and why it works better in some European countries that have a more integrative and streamlined system.
Mm-hmm.
I also think sometimes we have this perception of kind of a false dichotomy that at the hospital, if something goes wrong, within seconds, your baby can be born via C-section. And if you're at home, there's nothing there to help you out. And it's just not reality. Many hospitals around are the way you described yours, Shari, where the doctor has to come in from home to do a cesarean. And
the OR crew has to come in. They don't have
anesthesiologists and everyone.
Yeah.
And if we're coming in from home, we're calling ahead. We're saying we'll be there in 10 minutes. They can get ready for us. And we do have a lot of stuff at home as well. And I also just think that whenever you're thinking about home birth, you're not saying, I'm going to have a home birth at all costs. I recommend to my clients, they say to themselves or to their loved ones, if everything goes well, we're planning on having our baby at home.
With our midwives.
With our midwives, because that's the context that we think about it in, right?
Yeah.
That we're not assuming, if birth was always straightforward, you wouldn't need midwives. You just have your partner and your auntie and maybe your mom. They catch the baby, you go on with life. But we all know it has potential complications, which is why you need to have a trained provider.
Absolutely. Let's talk a little bit about midwifery care. We're going to do another episode on midwifery care. But I want to just mention and talk. We're sitting here, 3 of us are midwives, and we're talking about midwifery care at home. And you mentioned, Ami, about there's different types of midwifery license. Some are not legal in all states. CNMs are in all 50 states. But what about home birth and midwifery? Is that the same in all states?
So CNMs are licensed in every state. The training that I'm what's called a direct entry midwife. So I did, and I am actually a registered nurse, but I actually went to nursing school after midwifery school. So I went to a 3-year midwifery training program that was just training in out-of-hospital birth. So I'm not trained to catch babies in a hospital setting. I'm trained for birth center and out-of-hospital and home birth. And then again, I ended up for other reasons going back and getting an RN. And that direct entry midwifery, the national license is a certified professional midwife. In California, we call them licensed midwives. And actually, interestingly, in California, my license gives me more autonomy than Nancy's. So I actually have better legality here than Nancy does. But in some states, my license is completely invalid. Could get arrested for practicing medicine without a license, considered illegal. So it is something to know, depending on where you are in the country and kind of what your options are. As far as I know, home birth itself isn't illegal anywhere. It just depends on who the provider is.
Still, unless you have a doctor with you.
Yeah, maybe you would know better.
You can always have your baby at home by yourself.
Right.
That's never illegal.
With you. Right, exactly.
Yeah. And the thing that I thought was really interesting, I didn't really know that much about kind of the different types of midwives and midwifery training. But, direct entry midwives or licensed midwives like Ami, who are really trained to provide care to women outside of the hospital, their requirements for graduation in terms of the number of births that they manage are significantly higher than the number of births required for a CNM or a family doctor who does OB. Like the numbers are much higher. Yeah.
Right.
Yeah.
Right.
And I mean, it makes sense, right? Because
Right.
like we talked about anticipating, I don't have an OR across the hall and am trained
Right.
to know that I'm not going to have that. I might be.
And you're practicing independently. You know, when you're a midwife practicing in a hospital, like you have a lot of support and systems around you. You know, you continue to get precepted and, you know, there are people with you and yes, you have, you know, may have an assistant midwife or someone with you at home, but it's not the same.
Yeah,
absolutely. You know, I know it's changed so much. I became a midwife in 1996. So that was 21 years ago. Is that 21 years ago. And back then, you know, just 20 years ago, people used to say to me all the time, so did you go to school for that? You know, did you actually have to go to school? There was so much misperception about, you know, about what midwifery is and, you know, how trained and how much training and how many births and just really how prepared we really are. And even as a CNM, what is included as far as our licensure, what we can do, prescribing medication, doing well woman visits, and all the other things that midwives do. And you cover this in the film too, you know, about just the kind of care that is available, not just for birth, but through midwifery care. I find that there are more people, what?
Oh, I was just going to say, you were talking about, you know, midwives and people not understanding what a midwife is. I think part of that is because only 10% of the births in the United States, in any location, are attended by midwives.
It's crazy.
Like, it's way underutilized.
Oh, yeah. So different
than in other countries.
Right.
Yeah. So different. And you wonder why our rates are you know, morbidity and mortality rates and everything else when it comes to, you know, pregnancy, child are so high compared to other places in the world. The care is really different.
And even within the United States, practices that have midwives have better outcomes, fewer C-sections, fewer infections, more vaginal births,
higher breastfeeding
rates, that midwifery care in whatever context actually consistently across the board improves the outcomes.
Yeah, absolutely. That's for sure.
Which
that we know.
One of the other reasons why, and again, I keep sort of thinking about these ProPublica reports and the maternal mortality, and particularly the higher rates in the African American communities. And I just feel like the way that we've set up our care system deliberately hurts women in the inner cities and in rural areas. And those are primarily, unfortunately, minority women. And it's just, the whole system is really not set up to support families. And a lot of those states where midwifery is illegal or is marginalized, we see some of the worst rates in the country. And I think that we need to use this resource as much as we can and start helping train women to go back into their communities and support their friends and their family members and their colleagues, because I think it's an incredibly valuable resource that we're not tapping into. And that's the kind of the social justice piece of me and being a midwife and wanting to, I think so much of midwifery care is supporting women and supporting families and doing relationship-based care, which is so different than the typical obstetric model, which is, thank God there are obstetricians, thank God there's surgery. It does. I don't mean to downplay it, but so much of the time, what you really need is a trained care provider who knows you and your family and is nearby and has access to a handful of medications in the rare event of an emergency, and you know, you're good. So.
And isn't it amazing how if we just came to birth with that opinion or that feeling as women, if we came to birth without that fear, it would just support even better outcomes altogether. So it's sort of this vicious circle of, you know, you have all these interventions, you have all these outcomes that are caused by that in many ways. And then that creates all these horrific stories that we all hear and share. And, you know, and then that creates more fear, which then creates more of that.
Yeah.
Yeah. I want to share with everybody, I'm going to take a little break for a second here. You guys, I have something for all of you. I shared it with you on Saturday night. It's a little breastfeeding mini series that I created for you, a 5-day series of videos on breastfeeding myths and facts that I created. And we're going to go ahead and let you all join that right now. If you want to get my mini series, all you have to do is right now in the comments, just type the word myths. Type the word myths in the comments, MYTHS, and you will get those videos. You're getting them? How do you like them? For those of you who are already getting them, you've been getting them for the last few days. Did you like the videos? Yes? Okay, awesome. I hope so. Yeah, so just type myths right there and you will instantly get a message from me. And don't leave us now. Keep watching, but afterwards you'll have it in your messenger to go ahead and get your series. Excellent. And one more time, let's talk for a minute about our prize. It's Earth Mama Organics. I'm going to, here we go. All my favorites. Actually, these are not all of my favorites. The breastfeeding products are amazing too, and I'm sure we will have them back on to give away breastfeeding products, the nipple butter and everything else. Today we're doing a little bundle of postpartum and birth products, the spray, which I had with me when I delivered, the herbal sitz bath, all the fantastic products for pregnancy, for birthing and for postpartum. And we're going to give away that little bundle today from Earth Mama Organics. You're getting really quality products from them. I know the owner, Melinda, is an herbalist. She's a registered nurse. Everything here is completely organic and non-GMO and just safe for your body. When you're drinking teas, when you're putting on lotions and creams and on yourself and your baby, it's really important that you know that what's in those products is safe and does not have all the chemicals and parabens and other yucky stuff that you don't want going in. So especially for your babies too. So check them out. Joe's putting the link, and if you want to win the bundle, just love or like the post and comment here right now. Tell me what you love about Earth Mama Organics and why you'd love to win, and we'll pick a winner. Okay, let's go back to our conversation. We have a little bit of time left here. I want to talk a little bit about, we've covered so much already, but what about you had mentioned about medical insurance not covering it, which is crazy because the costs are so much less to have a home birth. For them to cover this would be their advantage, but let's talk a little.
Sure. You have to understand that we have a medical system that's really controlled by doctors, much because they are very actively trying to keep control over everything related to health. And that includes the insurance systems. I would say that while, we're not in network with insurance companies, we do bill them, and many of our folks get a significant amount of reimbursement. So don't feel like you can't get any insurance reimbursement. It really depends upon your provider. Many of our folks got the majority of their payments back to them. It's a little tricky with like HMOs and Medicaid. It's harder to access those funds, but in many states, out-of-hospital midwives do. It's really state.
Yeah. It is. I mean, it is, as Jessica mentioned earlier, you do have to mostly pay out of pocket ahead of time, and we bill after the birth. So it is restricted to people that have the ability to pay out of pocket ahead of time. That being said, most midwives also, if they can't bill directly to insurance, often will do a sliding scale or have a certain amount of deliveries that they can do a year for very reduced cost. Because while we do need to make a living and support our families, we also do want people to have access to midwifery care and out-of-hospital birth. And like Nancy at the birth center, they have a nonprofit attached to the birth center that helps to support and fund families who want to deliver here who can't pay out of pocket and don't have insurance that will cover. So it's often, if there are families listening who are interested, just ask. Talk to midwives around, because you may be surprised at what's available.
And I'm seeing a bunch of people in the chat commenting here saying that they were able to get in-network exception with their insurance companies, that some so it's like they're saying, it's different, depends on your insurance, and definitely don't assume that there wouldn't be coverage. That's great to know. That's great. there were some questions that came in when we did the promotions for the show, and I just want to answer a few of their questions. We had touched a little bit on what would risk someone out. We kind of said it kind of quickly. I just want to spend a few minutes because it seems like that's one of the big questions. Like, can I have a home birth if I, have had a prior C-section, if I'm having twins, if whatever. So Gina asked the question, can you still give birth at home when you're high risk? What does high risk really mean when it comes to home birth? And it's a different conversation. Like, home birth high risk is different than hospital high risk.
Definitely. Yeah. So it really, again, it depends on what state you're in, who your midwife is, what she's comfortable with. Like in California, my license now, we're no longer, even if I wanted to do twins or breech, so non-head first babies at home, legally, I'm not allowed to. So some states, historically, I even when I was legally allowed to do it, I didn't, because it's not something I have experience with and didn't feel comfortable. So some of it is sort of your midwife's experience, her practice, what she feels comfortable doing, but part of it's state laws and legislation. Generally speaking, again, one baby, head down, healthy mom. Some people restrict by age. Certainly can't do that here. Most of our moms would be considered AMA, including myself. So we advanced maternal age or geriatric pregnancy, as some people.
Right.
Pretty much everybody in San Francisco. So we don't restrict by that. You'll see, again, preterm babies, we don't do at home, post dates. Prior cesareans or a VBAC or HBAC, as we call it, home birth after cesarean. Again, it depends on your midwife's comfort level, depends on the legislation, depends on what the cesarean was for and kind of the circumstances around it. Did you have a cesarean with your first and then had 2 successful VBACs in the hospital and now this is your 4th? That's a very different story than someone who had 2 or 3 emergency C-sections and now they want to have a home birth. That would be a very different discussion, and again, completely up to your midwife and the midwives in the area and sort of what their comfort level is and what they feel good doing. So other high things that would risk you out that would develop during the pregnancy, gestational diabetes that can't be controlled by diet or exercise. So if you need insulin, that usually will risk you out. Blood pressure issues, so preeclampsia, things like that towards the end of pregnancy.
Severe anemia.
Issues with the amniotic fluid. So if all of a sudden there was very little or a huge amount, those can be signs that there's other issues going on and may risk you out.
Ultimately, there's a long list of reasons that you can imagine would rule you out for a home birth. I mean, and I think Ami covered the most common ones, but there are some things that people think of, like, oh, I can't have a home birth because of that, like being over 35.
Yeah, I'm 40. I can't have a home birth.
That's not a problem for us. Or being booby strep positive. We have the ability to take antibiotics if you're GBS positive and you choose to get them for your labor. So those things are not a barrier. Some things that women think of are a barrier just aren't.
Right.
Something, a little piece of data that we share in the film is that, when you go through kind of, all right, this is what a low risk pregnancy is. Well, 85% of women are low risk pregnancies. Like most people are going to be low risk. So I think that's also kind of important to remind ourselves of, because it can seem like it's so risky and, there's all kinds of risk. And while, there is risk in birth, most birth is not high risk.
Mm-hmm.
Yeah. And it's just the drama that we see, depicted. It makes it in TV and movies, it makes it look so much scarier than it is. And I was just teaching a childbirth class the other day, and we started down this dark path of all the horrible things that could go wrong. And finally I was like, you guys, there are 7 billion people on the planet. 50% of them have no one with them at the birth who knows how to do anything. And most of the time they're still successfully delivering healthy babies. So just take a deep breath. It's going to be fine. Most likely everything's going to go great. Yes, there are millions, we like to say in medicine, there's a million zebras, there's a million weird little things, but mostly you're never going to see one.
Yeah. Yeah.
There was a question about the 2 emergency C-sections. So, every time you have another C-section, it increases your risk for complications on a next pregnancy. I don't know what Nancy and Ami would say about that, and it would probably depend on your midwife, but that would be a higher risk pregnancy, I would say.
Yeah.
And just important to know what the risks are and be very clear with yourself about what risks you're willing to take. And certainly as midwives, we're always considering what risks we're comfortable with. The hard thing that I find talking to women who have had cesareans with their first and want to have home births with their second is that they often feel that the hospital failed them, and that's how they ended up with a cesarean section. My heart just goes out to them, wanting to support them in this alternative path to birth. And on top of that, there are still lots of places in this country that don't have providers that will do VBACs. So if you want to have a cesarean at all,
or VBAC at all.
I'm sorry, if VBAC at all, you have to go out of hospital first.
Yeah. So there's a lot of people that are doing VBACs at home just because that's the only way they can get a VBAC. Or like here, we have people that would choose home birth just because they want the option of a water birth, and there's no hospitals in the Bay Area that will let you deliver in water. So that's another thing, that some people choose home birth just so that they have the option to have their baby the way that they want to, that there's some very specific requests that's really important to them.
And a lot of those things are not difficult for hospitals to change, to do. I think that's really another message that I want to continue to promote and through the film is that, there are ways that the hospital can become more, family centered and give women and families more autonomy and choice. And it doesn't have to be so hard, different positions. I heard a story about a woman, who wanted to, she was, it was her first baby and she was on all fours and gonna, push her baby out on all fours. And the doctor would not get on your back, turn over, get on your back, why?
It's just upside down.
Well, that's so much of that is going to be about changing policy within the hospital institutions, but also for women to really educate themselves to make the right choices for their providers. So much of the time, they just moms don't think about who's actually going to deliver this baby. The prenatal visits are not going well. The prenatal visits are, you're going in, you're not getting your questions answered. You're not agreeing on things. And then you think somehow that it's going to get better with the birth, and it usually gets worse. And so I always say, when I was in practice, moms would call me at 38 weeks, 39 weeks, is it too late to transfer? And I would say, is the baby out? No. Okay. It's not too late to transfer. You need to find somebody who you're going to feel comfortable with, who you're going to be in sync with, where you can really let go, where that person has the same mindset as you, whether you're in a hospital or home.
Right. And we have this funny perception that the person who does our pap smears is just the person who should catch our babies. And
right. Right. No, wrong. Unless that person who does the pap smear is your midwife and you left her.
Right. Or that we feel some sort of obligation because we've been seeing them for our pap smears for 20 years, that we must let them catch our baby. And I think that's a really good point that women to empower themselves to make those choices and to find the right person. And if it doesn't feel right, to not be scared about switching care, because this has the potential to be an incredibly empowering experience and has the potential to be an incredibly traumatizing experience.
Absolutely.
And so much of that is who's in the room with you in that moment, and are you able to be a participant in your care, or do you feel like something's been done to you? And I mean, even with midwives, we talk about so much of it, even just with our language. I've never delivered a baby. Well, that's not true. I've delivered 2 babies, my 2. Every other baby I've caught. It's not, moms are doing all the work. They're doing the delivering. I'm not here to save you. I'm here to help guide you through this process. And I think it sounds sort of small and trite, but it's big. That language is big, and encouraging women to feel empowered to make those choices about their own bodies and how this experience is going to go is really sets you up to be a good mom. I mean, it sets you up to deal with toddlers.
And teenagers.
I'm terrified about that.
I won't even talk to them about that.
One of the most kind of exciting things along those lines that I have been able to do with the film is to share it with some high school classes, which I think is just, it's unfortunate that you don't really think about these things until you're pregnant or until you have one birth that goes terribly wrong or is traumatic. And, to really expose people to this information early on when they're young and curious, and then they kind of have that in their mind, like, oh yeah, I have some agency around this. I have some choices. There are options, and this can be, a powerful, beautiful, empowering experience.
I love what you're saying, because I used to hear that all the time, and I still do. It's my first, I maybe with my second, as if I'll sacrifice this first experience. This experience is sacred and precious to you, and this is your birth, and so there's nothing to wait for. If you're whatever your experience that you're looking for, seek that out, whether it's being in a hospital with the right person, a midwife, whoever it is, or being at home or in a birthing center. Choose the birth that will make you feel empowered and happy in the end. You can't control the outcome, but you can control your choices about how you get there.
Absolutely.
Absolutely. Oh my gosh, ladies, thank you so much. The whole hour is up already. It goes too fast. This was such a good conversation. And for everybody who didn't see the beginning, make sure that you go over to whynothome.com and watch the film, Jessica's film on home birth. Fantastic. You'll see both Nancy and Ami in the film, and Jessica, and others that will really inspire you and have you thinking about this other choice for your birth, possibly. So thank you so much for joining me tonight. It was so fun to have you, and I'm so glad we finally got here.
Thanks a lot.
All right, everybody. And if you want my breastfeeding myths series, make sure that you type myths into the comments, and make sure that you registered and commented for the prize tonight. All right. And we'll see you in 2 weeks. No show next week, but I'll be back in 2 weeks with Rebecca Mickey. We'll be doing our breastfeeding and sleeping Q&A. Woohoo. And I'll see you all. Have a good night. Bye, everyone.